Joining us now is Dr. Debra Houry, the CDC's former chief medical officer who resigned from her post under Health Secretary RFK Jr. this summer, citing, as she saw it, the agency's lack of scientific leadership. Dr. Houry, thank you so much for joining us. Welcome back to Prime. First off, I'd love for you to share with us some of the risks involved when you don't vaccinate children against hepatitis B when they are born, and instead recommending a first dose at 2 months.
Yeah, so at birth is when a child is most at risk for contracting it from a mother. And, there can be a false negative test. Or sometimes, moms get lost to follow up or might deliver at home. Those children who aren't vaccinated can be really at risk for going on, if the mom was Hep positive, for developing long-term liver disease. What's concerning is if you have hepatitis as a baby, 9 out of 10 go on to develop chronic liver disease. That's different if you're older. So that's why it's really important to vaccinate newborns. And CDC, some of the studies that we had looked at were that if you do delay that dose, up to 1,400 new cases of hepatitis can happen.
Doctor, why do you think the CDC is saying it's best to vaccinate at 2 months?
Well, I'm going to say this is a different CDC, and this was a CDC vaccine panel. No CDC career scientists or vaccine scientists presented data. What we saw were people that had ties to outside groups, or one is like a CDC contractor, and 2 of them actually who presented had retracted papers on autism. That's who was presenting this data.
I see. And how might hepatitis B infections increase, let's say 6 months from now, years from now?
Well, I think we'll start to see that as vaccines get delayed, because even if a mom is Hep B negative and they decide not to vaccinate the baby, that doesn't mean that the child's not going to get exposed in daycare or in other household exposures. So we are going to see an uptick of cases. And this is heartbreaking. We've already seen 5 children die this year from whooping cough and measles. Those are vaccine preventable. Now we're going to see hepatitis cases.
Now, when President Trump and RFK campaigned together, you may remember this, they repeatedly promised to make America healthy, and RFK in particular promised to follow, quote, gold standard science. You believe he's not following the science. So what is he and most immunization practices committee members following if it's not science, if it's not data?
They're following anecdotes, and we even heard from RFK's ally and lawyer today, a vaccine injury lawyer, presenting to the committee versus a scientist. The secretary in October fired the Institutional Review Board members and ethics committee. If you want gold standard science, that's exactly what you need at the agency.
And Doctor, quickly before we go, Steve Osunsami spoke about this in his report just a few moments ago. You're a former CDC employee. Should people and parents still be turning to the CDC when they have questions about vaccines? And if they shouldn't, where should they look to? Where can they get their information?
Yeah, unfortunately, at this time, I would say you cannot go to the CDC for information on vaccines. You should go to your pediatrician. The American Academy of Pediatrics has done a great job of providing information that makes sense. This is when I just tell people, ask your doctor about what is best for you in vaccination.
Dr. Debra Houry, former CDC chief medical officer, thank you so much for your time this evening. Really appreciate it.